Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
What are some factors that hinder a patient's ability to execute a medication plan?
It is incredibly important to understand any kind of socioeconomic determinants of health that could be influencing a patient's ability to take medications. For number one, cost alone of the medication is a huge factor. As you add the number of medications that they take, it makes their complexity go up in the way that they actually can adhere to that regimen, which limits their ability to understand which are more important than others. As you add chronic disease burden in general, becoming compliant with those regimens becomes more difficult as well. So there really is multifactorial components, even as such as medication that requires refrigeration. And if they don't have ability to keep medication in a steady state, it may not be as effective. So really, everything from housing and the ability to afford the medication, as well as the compliance issues with regards to the complexity of simply using medication boxes. It really adds to the complexity of the whole issue. Transportation, in a sense of getting to the pharmacy to actually pick up the medication, or making it even to provider visits, definitely is a contributing factor. And if you really want to get down to it, there's a percentage of patients with homelessness and difficulties just finding a secure place to live, making their security of holding on to some of these medications more difficult.
Why is it important to have a discussion about the affordability of medications?
The cost of medications has become easily apparent as one of the biggest factors in understanding why quality outcomes may not be as good as they should be. We've definitely seen through our data that as many as 25% of Americans do not actually understand the cost of their medication, and actually it influences their ability to decide on whether to fill the medication at all. It makes it almost impossible for providers and physicians to understand, are they following recommendations and adhering to that recommendation, which really inhibits our ability to make adjustments and manage chronic disease and lots of topics surrounding healthcare in general.
How does the affordability of medications affect patient care?
In a simplistic view, if you're not taking your medications, it's difficult to manage chronic disease. And although you may come in and talk about the medication with your provider, if you're actually not filling the prescription and taking it, it will become readily apparent as management of the disease becomes more difficult. Sometimes we can actually have frank conversations about that and try to understand why they're not taking that medication, which is really important, not only from the patient themselves, but even their family members.
What are some concerns if a patient is not following their prescription plan?
From a population health perspective, we want to manage in the community as best we can these chronic diseases. And in order to do that, we need to ensure that recommended medications can at least be readily available and taken properly in order to make that happen. Complications such as diabetics losing feeling in their feet, affecting their vision, all is related to their ability to not only manage their diet, but to take the medications as prescribed. That goes hand in hand with certain dietary recommendations and regimens that we would typically recommend to folks. So it directly does impact our ability to impact their outcomes.
How can someone struggling with medication affordability get help?
Resources have been developed and really hone in on two big components. Number one, just socioeconomic determinants of health in general. If you don't ask those questions, you'll never hear the answers. So we've developed some screening techniques to ask some general survey questions that help hone in on some of those things that they might not be forthright with telling us that directly impacts their ability to afford or pick up the medication in general. Some of the other resources is directly related to who could I call and talk to, or what could I read about, or what can I actually review with some family members to help make some of these decisions. So we've actually developed some card information in a brochure format that simplifies the process of who could I call to get help making decisions about my medications, whether it's how do I take it properly, what are some of the complications or side effects, who can help me make decisions as far as cost, how do I prioritize the medications. And there is a wealth of resources available. It's just a matter of getting them in front of the right people and having them follow through on that. Things like the Mass College of Pharmacy which really has a live person phone call that does not go through any kind of robotic phone tree, where you pick up a phone, you call that person, they pick up the phone and walk through your medications with you. They can find medications at a cheaper cost, can find supplemental revenue for that filling of the prescription, and they have a lot of relationships with some of the direct pharmaceutical companies to try and make that happen for the underserved population.
What does the term population health refer to?
Population health is clearly the mission of improving the outcomes of chronic disease in the communities that we serve. It includes chronic disease management as well as wellness. We know that accessing healthcare systems is not always the simplistic view of people in the community itself. So we think of ways to align and strategize to take the care to them directly, involving populations. So whether it's the city of Worcester, whether it's Worcester County, whether it's the individual communities, there's tons of resources provided by community-based organizations that supplement traditional healthcare. And it really is the ability to align and collaborate with those resources with a holistic view of taking care of patients individually.
Does affordability affect certain demographics?
It does span globally across. For example, in the pediatric world, there's some very expensive formulas for newborn infants that are pre-digested amino acids and incredible costs. Diabetics with insulin demand, really expensive medications. They're very high-end hematology diagnosis problems that are related to inability to stop bleeding or having problems with blood clotting that are very expensive medications. And that really has no age group or ethnicity or anything related. It spans the whole population. There is no doubt that the population is aging, which is a contributing factor to this, but I think that it's been persistent and has just been escalated by the fact that, you know, financial strength within all ages has been declining over the last several years, and it has a major impact on people's ability to prioritize how they spend the money that they have.